Howdy, my name is Adriana. I'm group leader for Group 52, working on case 2 this week. I'm working alongside Peter, Pavia, and Amanda. So just a little introduction on the case that we covered this week. It's a mother from a sub-Saharan African region. She arrives in a rural county in Texas with HIV, and she has expressed that she does not want the father of the baby to be notified of her HIV status. But as a licensed healthcare professional, we must put the health of others as a top priority, while balancing the patient's wishes to the best of our ability within realm of reason. We will be discussing the requirements that are outlined by the state of Texas for licensed physicians and the implications that follow. So what is the scope of practice for each professional named in the case? We're going to break it down by nursing, pharmacist, and physician.
Hi, I'm Pavia. I'll be doing the nursing part. So the scope of practice for the nursing team is to advocate for the patient, respect their health decisions, and be transparent and educate the patient about all of the options that they have. They should collaborate with the whole healthcare team to receive and report vital information, because the nurses do have, the most contact with the patients throughout the day, and to keep patient information up to date to the rest of the team.
Hi, my name is Amanda. I'll be presenting the part of the pharmacist. So pharmacists have to respect patient health decisions. They also dispense and counsel on medication that the patient is receiving. So this could be done either in the clinic, before or after, or on the telephone. And also a pharmacist must be available to answer any questions the patients may have.
I'm Peter. I'll be speaking for the scope of practice for the physicians. So physicians as leaders should be having the tough heart-to-heart conversations with the patients regarding her decision and the potential consequences that may come from those decisions. So as physicians, we should carefully communicate and consolidate the recommendations of the entire healthcare team that includes nursing and pharmacy, and incorporate that in our conversation with the patient. Additionally, we should also be mindful of other patients' cultures and perspectives so that we don't offend them, and we try our best to be as sensitive as possible.
So personal feelings aside, what role does an interprofessional team have in engaging the patients? So first off, clear communication with the patient. That includes clearly telling her what her diagnosis means for her and her child. In the case, it mentioned that she wanted to continue, or she wanted to breastfeed her child. She feared being ostracized if she didn't. She feared having questions about why she wasn't breastfeeding if she didn't from her community. The recommendation in the US is that HIV positive mothers do not breastfeed to avoid transmitting the disease to their child. So discuss that with her. Like Peter said in the previous slide, being as sensitive as possible to her perspective and her culture. And clear communication also includes informing her clearly that the healthcare providers by law are required to report the positive test results, make sure that she's aware of that and all the implications that that could have. And one of the implications is, the way her husband might react, because we have to report the positive test results. They will then contact her husband as someone who might have been exposed, and being married, he's going to put two and two together, so he's going to know. So it's also our responsibility to counsel her on how to discuss the situation with her husband, since it's probably a good idea to discuss that with him before he finds out. And alongside that, we should assess for possible safety risk at home, since she won't be here for much longer, and we want to make sure that when she is discussing this sensitive information with her husband, that she's safe, doing it in a safe way. And you can also offer to discuss the results with both of them together at the clinic, just in case either of them have any further questions. And then in addition to that, offer resources for her mental and physical well-being. This includes counseling services, because it's obviously a very difficult time for her. In addition to, becoming a mother, she's also having to deal with her diagnosis. She's having to deal with how her community is going to treat her after this. having to deal with how to discuss the situation with her husband. So counseling services would be a very good thing to offer her, as well as getting her in touch with the social worker if she expresses any concern for safety at home, or if you think there might be any safety risks at home.
So, what are the public health implications, and how do you balance surveillance with privacy? So, in this case, as a group, we've come to consensus that we would all agree that the decision to report to DSHS is a requirement, and reporting the HIV status of the patient is a requirement. However, a conversation can still be had with the patient, and so we think that that's the best way to kind of balance surveillance with privacy, while we understand that the patient herself has some qualms with like disclosing that information to her husband. I think it is up to us as a healthcare team to have that conversation and let her know the reason why we are having to do this, as in the decision to report, and also to communicate with her the reasoning behind our medical advice to, take the certain medications and to kind of really just try to ensure that her child and her family is safe and healthy. And although the patient does have a right to her own healthcare privacy, her husband and her son also have a right to know that they have been exposed to HIV and a right to be healthy.
So what are the Texas laws governing perinatal HIV testing? So the state of Texas requires in the first prenatal visit, testing of syphilis, HIV, and HBV be completed. At the third trimester visit, the state of Texas requires syphilis testing and HIV testing. And then at time of delivery, they require syphilis test, HBV test, and if the HIV test of one of the two previous visits was not successful or wasn't obtained, then it's absolutely required at delivery. Texas law also requires physicians or others permitted by law to attend a woman during pregnancy or delivery to test her for HIV, syphilis, and hepatitis B. So even without patient consent, one way or another, she has to get HIV tested, whether she wants to do it at the hospital during the delivery, or if she wants to go to a private testing facility and get that completed, it is required for her to do that. Physicians or a designee are also required to report any case of HIV or AIDS. So, like mentioned previously, this result will be reported, and ultimately the husband will be notified as a contact of HIV.
And now we're going to talk about how the antithesis nursing team and pharmacist should respond if the husband asks what the medication is for. As a pharmacist, we would dispense and counsel on the heart medication to the patient. Counseling can be done prior to pickup. It could be done at the clinic or via phone call. It doesn't have to always be in person. The pharmacist does not need to give any information to the husband if the patient does not want that information to be shared. For the nursing team, they would just refer the patient's husband to the pharmacist for further information about the medication and how it should be used. This was our presentation on case 2.